Hello, everybody. I hope you guys are having a fantastic day. I just listened to an amazing interview on YouTube. I'm going to post it in just a moment for the second half of this video. But in the first half of the video, I am going to abbreviate everything that I heard and give you some of my own thoughts. This is a keynote speak done by Palantir. The person that was speaking was Joanna and her counterpart. I didn't get his name, and they are essentially in charge of healthcare services within Palantir. And she did a fantastic job to speak to the entire audience. One of the main things that I noticed is she says, hey, can you guys pick up your hands if you ever heard of Palantir? Literally 3 people picked up their hands. 3 people in the entire room. And she even said this. She's like, listen, it shouldn't be that only 3 people in a room full of people heard of Palantir. So the fact is, nobody knows who Palantir is. Nobody knows what Palantir does. I still have yet to meet anybody that's a developer in Web3, for example, that heard of Palantir, because I'm in crypto as well. And I always ask people, did you hear about Palantir? Did you hear about Palantir? The only people that ever heard about Palantir are the people that are in law enforcement or in the military. The video is going to be 9 minutes. I highly suggest that you listen to it because they break down a lot of details when it comes to Palantir, but let me give it a shot and break everything down. Before we go any further, hit me up with the comments and give me the algorithm comment down below. Literally comment anything. You want to troll me, you want to make fun of me, that's good too. That helps with the algorithm as well. So she goes on to say that Palantir clients use Foundry and Gotham software platforms to drive change. She goes on to talk about data, that data collection is not enough. You need to be able to do a feedback loop with the data that allows the data to be used in real time and actually make a difference in healthcare. And this is one of the things that we talk about and criticize the competitors of Palantir, that they just collect data that you can roam through yourself. While Palantir has an interactive site where they take the data and allow you to allocate that data in real time and actually get something out of that data. There's a huge difference. They went on to talk about Palantir and who they work with. They talked about the NIH. They talked about the Human Health Services. They talked about Sampo nursing homes out of Japan. And then they made an emphasis with NHS. They specifically spoke about NHS. Maybe wink, wink, we're going to get the NHS contract. Who knows? They talked about that they were able to distribute 9 billion items of PPE distribution. They distributed tens of millions of vaccines in the UK across 15,000 different locations within the country. And they said that Palantir is trying to alleviate backlog as well. And they gave a specific example. I don't remember off the top of my head, but you'll listen to it in the video, where they saved waiting time by 30% using Palantir. They went on to talk about the complexities of healthcare. Complexities of healthcare come in 3: system complexity, organizational complexity, decision complexity, and then they break down all of these complexities. They said that in order for healthcare to work, you have thousands of decisions daily across many sectors, in many departments, and many locations. And in order to make healthcare work, you need an ability to put all this together and actually make the data interactive and decentralized. And then they went on to speak about how Palantir meets all the demands of what I just mentioned, so on and so forth, making healthcare more efficient. That's a quick abbreviation. The video is going to be 9 minutes. I highly suggest that you guys listen to it because you get a lot of insight when it comes to Palantir. And the video itself only has like a couple of 100 views on the actual site. So I think we're going to give it a lot of boost, which is good. The more eyes and the more ears that we have on Palantir, the better it is for all of us. Thank you so much. I hope you enjoy the rest of the video. Like, share, subscribe.
Hello, good afternoon, everyone. My name is Joanna. Is your mic on? Just checking. Okay, cool. And we are both software engineers by background, but it is currently our honor and privilege to be able to lead the healthcare division at Palantir Technologies. And for those of you who haven't heard of us, and actually, can I have a show of hands? Who's heard of Palantir? 1, 2, 3. Okay, I see 3 hands and a lot more people, and that's exactly why we're here today, to tell you a little bit about who we are, what we do, what our company is all about. So Palantir Technologies was founded in 2003 in Palo Alto in California, currently headquartered in Denver, Colorado, and we are a software company. So we have two data platforms. One is called Foundry, the other is called Gotham, and our customers use that software, those data platforms, to drive transformational change. And those customers come from both the public side and the private side. So what we're going to talk to you about today is really the idea that data alone is not enough to drive transformational change. And really, it's data empowering decision makers, creating a feedback loop into a single source of truth that really drives that change. And this is, of course, particularly difficult in the healthcare world because of the inherent complexity across healthcare. And we will talk about that complexity and kind of our views on it. But first, maybe give you a little bit of context on our work in healthcare.
So Palantir is trusted by some of the world's largest healthcare and life sciences companies around the world and institutions around the world. Some examples include NIH in the US, where Foundry is used to help accelerate critical research. The US Department of Health and Human Services. This is where Foundry is used for vaccine allocation, both COVID and now more recently monkeypox. Also, Sompo in Japan Foundry is used directly within nursing homes for personalized responsive care. But I think perhaps some of our most advanced work is actually at the NHS in the UK. This is where we've had our software used since 2020. And some examples here include over 9 billion items of PPE have been distributed across the UK through Foundry. Over 121 million vaccines have been distributed, allocated, tracked through Foundry. And this is also with over 15,000 users across the country. And then also helping to alleviate the elective backlog, one of the seminal challenges that we have today, with over, for instance, 30% reduction in the inpatient waiting list at Chelsea Westminster, one of many hospitals that our software is currently deployed at. Now, it's really through these challenges and through these experiences that have allowed us to more deeply understand the inherent complexity within healthcare systems.
And just to hello, yes. Just to kind of dig into that complexity, what do we mean by complexity? How can you start to tackle it? How do you start to categorize and subdivide it? I like to think of three kind of categories of complexity, specifically in healthcare systems. You have system complexity, you have organizational complexity, and finally, and potentially most importantly, you have decision complexity. So system complexity refers to the technical infrastructure that underpins the healthcare world. Things like EPRs, things like staff rostering system, things like primary care data systems, things like data warehouses or various other kind of mid-tier data management layers. All of these different systems make up the world of a healthcare institution. And so there's a lot of complexity. Even if you look within one healthcare system across different sites, there's a lot of complexity with what kind of the systems they're using, how advanced are those systems, and what does that look like? So that's the first. The second complexity is organizational. This is who makes up your healthcare organization. This is how many clinical staff do we have? How many administrative staff do we have? What do the general managers interact with my data? How do my schedulers interact? All of the kind of the people that make up healthcare institutions are going to look different, again, site to site. There's another layer of complexity. And then the final layer of complexity is those decisions. When we think about healthcare institutions, it's not one or two or three people making decisions that you then kind of need to use data to make those decisions. It's thousands and thousands and thousands of decisions being made every single day at every single level across healthcare institutions. And that's really how a healthcare systems runs. It's with every single person making those minute decisions every single day. So how do you address that complexity? What principles can you use to both kind of optimize the healthcare system overall while we're working within and for those boundaries of complexity?
So it's really threefold. The first is the creation of a single source of truth. And this is really the integration of all of that highly disparate array of source systems across a health system. Everything from legacy mainframes through to modern cloud infrastructure, and of course, everything in between. And this is not only the integration with all these systems to have that baseline understanding of how things are progressing across your system, but it's also to do so in near real time, or as near real time as possible. So all decision makers have the same access to the same data, of course, permissioned off, but at the same time. An example of this in our work has, of course, been the vaccine supply chain, where we have over 15,000 users across the nation, everyone from executives at NHS England level, understanding the overall performance of the program, all the way down to vaccine center managers, understanding the performance of their own center, and perhaps the locations nearby, maybe for mutual aid circumstances. The second is a mechanism for decentralized decision-making. And this is really allowing the infrastructure to have decisions across entities. So for instance, across hospitals to community or primary to acute. Allowing these decisions to manifest is something that's a deep architectural problem. Now, one example of this that we currently do is discharge, and making sure that you can improve that transition of discharge into the community. And this is where we've integrated not only in the acute, but also the local authority, and then finally care homes, bringing those together and allow decisions to take place. The final part of this, of course, is the provision of write back. And this is, again, a deep technical problem. You have to make sure that when you talk about radical interoperability, you're not just referring to read only, you're also referring to write back. That allows those decisions to actually be generated. And the final is the most important. This actually underpins the previous two, and that is ensuring privacy and security. Now, in the NHS, one way in which this is achieved is through purpose-based access control. Now, what is a purpose? A purpose is set by data governance teams to contain data specifically scoped to meet a user's goals. No more, no less. Data governance teams will provide the rationale behind granting access to any particular individual, and data owners will provide the rationale behind the inclusion of any particular data asset. And it's this constant record keeping of between these different user groups, automated through the platform, that allows you to have a deep, enriched understanding of who has what, who has access to what, when, and importantly, for how long. And it's really through these three key ingredients you can manage that inherent complexity across a health system and ensure collaboration that is safe and secure.
At Palantir Healthcare, we're really excited about the opportunity to contribute in some small way to the transformation that we see the healthcare industry going through. It's been really energizing to be here the last few days. We're just downstairs. Please come see us. We always like to talk. So you know where to find us, and we're really excited about the work that hopefully we can all do together to transform the future of the healthcare industry. Thanks, everyone.